Bismillahirrahmanirrahim. This is Dr. Anushay, Assistant Professor of Ethology at United Medical College in Karachi. And the title of today's presentation is Chromosomal Disorders. By the end of this lecture, the learner should be able to define normal karyotype, define common cytogenetic terminologies, discuss the structural abnormalities of chromosomes, discuss cytogenetic disorders involving chromosomes, and the cytogenetic disorders involving sex chromosomes. What is normal karyotype? It is a basically the study of chromosomes, and it is a basic group of cytogenetics. The human somatic cell contains 46 chromosomes, 22 homologous pairs of autosomes, and two sex chromosomes, XX in female and XY in male. To examine chromosomes, arrest cells in dividing phase in metaphase with mitotic spindle inhibitors, followed by metaphase spread chromosomes attached to the chromatids and then centromere and eventually divide into progenies. Karyotype obtained by arranging each pair of autosomes according to the length followed by sex chromosomes. The commonly used stains involve a gene stain and its genes called gene banding for identification of chromosomes. Approximately 4 to 800 bands per haploid set can be detected by gene banding. Individual chromosomes appear markedly elongated up to 1500 bands per karyotype can be recognized, and by using the banding techniques, identification of each chromosome and roughly deletes breakpoints and other gross operation can be made. There is some cytogenetic terminologies like the short arm of a chromosome denotes SP and the long arm Q. In a banded karyotype, each arm of the chromosome is divided into two or more regions bordered by prominent bands showing in the picture. The regions are numbered, example 1, 2, 3, and so on and so forth from the centromer outward, and each region is further subdivided into bands and subbands, and these are ordered numerically as well. Thus, a notation XP21-2 refers to chromosomal segment located on the short arm of the X chromosome in region 2, band 1, and subband 2. Structural abnormalities of chromosomes. Euploid. Multiple of the haploid number of chromosomes known as euploid. Error occurs in meiosis or mitosis, and a cell acquires a chromosome complement that is not an exact multiple of 23 is known as aneuploid. The usual cause for aneuploidy are non-disjunction and anaphase lag. When non-disjunction occurs during gametogenesis, the gametes form have either an extra chromosome or one less chromosome. The fertilization of such gametes by normal gametes results in two types of zygotes like trisomic or monosomic. In anaphase lag, one chromosome, homologous chromosome in meiosis or one chromatid in mitosis lags behind and is left out of the cell nucleus, resulting in one normal cell and one cell without monosomy. Subsequently, monosomy or trisomy involving the sex chromosome associated with variable degrees of phenotypic abnormalities. A change in numbers of chromosomes results of mitotic errors during the cleavage of a fertilized ovum or somatic cells is known as mosaism. And resulting of one of the daughter cells receive three sex chromosomes, whereas the other receives only one. All descendant cells derived from each of these precursors thus have either a 7XX complement or a 45X complement. The structural changes in chromosomes result from breakage followed by loss of rearrangement of material known as deletion. What is interstitial deletions? Basically, there are two breaks within a chromosome arm. Loss of chromosomal material between the breaks and failure of the broken ends is known as interstitial deletions. When we talk about terminal deletion, it is a result from a single break in chromosome arm producing a fragment with no centromer leading to the loss at the next cell division. And the ring chromosome is developed when both ends of chromosome with fusion of the damaged ends. Inversion. Inversion is a rearrangement that involves two breaks within a single chromosome with reincorporation of the inverted intervening segment phenotypically in normal individuals. Involving one arm is known as paracentric. If the breaks are on the opposite sides of centromere, it is known as pericentric. Isochromosome formation results when one arm of chromosome is lost and the remaining arm duplicated, resulting chromosome consisting of two short arms only of two long arms. An isochromosome has morphologically identical genetic information in both arms. The most common isochromosome present in live birds involves the long arm of the X and is designated as IXQ10. The XQ isochromosome is associated with monosomy for genes on the short arm of X and with trisomy for genes on the long arm of X. In a translocation, a segment of one chromosome is transferred to another, and balanced reciprocal translocation is a single break in each of two chromosomes with exchange of material. What is Robertsonian translocation? It develops when breaks occurs close to the centromeres with each chromosome. Transfer of the segments then leads to one very large chromosome and one extremely small one, with loss of the small chromosome and phenotypically normal individual. Cytogenetic disorders involving autosomes. Trisomy is one of the cytogenetic disorders involving autosomes, also called as Down syndrome. It is a genetic condition causes delays in physical and intellectual development. Major cause of mental retardation in which IQ level is 25 to 50. US incidence in newborn is 1 in 700. There are extra genetic material from chromosome 21, so individuals have 47 chromosomes instead of 46. The parents of such children have normal karyotype and are normal in all aspects. Increased maternal age has a strong influence on the incidence of trisomy 21. When we talk about etiology, it is developed due to an error of cell division of meiotic non-disjunction or during meiosis. One pair does not divide. Whole pair goes to one daughter cell over mostly resulting one cell possesses 24 chromosomes and other 22 leading to abnormal zygote formation. Types. Types of abnormality or cytogenetic abnormalities 9. Trisomy 21s are number one is non-disruption. Occur in 95% of cases due to abnormal cell division of sex cells. Number two is translocation, and it is occurs in 4% of cases due to the translocation of long arm of chromosome 21 to another ectocentric chromosome. The third one is mosaicism, and it occurs in 1% of cases caused due to mitotic non-disjunction, leading to individual with mixture of cells with 46 or 47 chromosomes. Maternal age is of no importance in this case. Clinically, Down syndrome or trisomy 21 appear as flat facial profile, oblique pulpitular fissures, epigenic folds, broad feet, flat bridge of nose, broad hand with symmetries, hypotonias, dactyly of little finger. And the associated abnormalities of Down syndrome are congenital heart disease, congenital malformations like atresia of esophagus, small bowel, or also common, and the malignancies like lymphoblastic leukemias and acute myeloid leukemias, and after age of 30, neurodegenerative disease like degenerative disorders can develop. This is the picture of trisomy 21 showing the clinically aware patient. To make diagnosis, the approach is history and physical examination, then karyotyping and radiological studies, antenatal investigation by using cell-free DNA and maternal blood is derived from the fetus, and by using next generation sequencing to identify chromosome 21 linked genes. Other trisomies like trisomy 18, also called as Edward syndrome, and trisomy 13, Potter syndrome, which share several karyotypic and clinical features with trisomy 21. Most cases result from meiotic non-disjunction and therefore carry a complete extra copy of X chromosome 13 or 18. As in Down syndrome, in association with increased maternal age is also important in these cases. And in contrast, to trisomy 21, the malformations are much more severe and wide-ranging. Rarely do infants survive beyond the first year of life. Most come with a few weeks to months. Another cytogenetic disorder involving autosomes are chromosome 21q11 or deletion syndrome. It is also known as microdeletion syndrome, result from a small deletion of band Q11 on the long arm chromosome by Q. Occurs in 1 in 4,000 births. Clinically recognized as syndrome with similar cytogenetic abnormality like George syndrome, Bello-Cardiofacial syndrome. George syndrome characterized by thymic hypoplasia resultant T-cell immunodeficiency, parathyroid hypoplasia giving rise to hypocalcemia, cardiac malformations affecting the outflow tract and mild facial anomalies. Bello-Cardiofacial syndrome characterized by facial dysmorphism, prominent nose, retrognathia, cleft palate, cardiovascular anomalies, learning disabilities, and rarely immunodeficiency. And the high risk of psychotic illnesses example schizophrenia and bipolar disorders. Attention deficit hyperactivity disorder. The investigations required to diagnose deletion syndrome with cytogenetic detection by FISH, fluorescence in situ hybridization technique. Okay, the next category is cytogenetic disorders involving sex chromosomes, and these are the more common than those related to autosomal aberrations. Positive normal sexual development and fertility difficult to diagnose at birth. The disorders involving sex chromosomes first recognized at the time of puberty. The greater the number of X chromosomes, both male and female, the greater the likelihood of mental retardation. On X chromosome, one X chromosome is inactivated in all cells during embryogenesis. It is selectively reactive in ammonia before the first meiotic division. About 21% of genes on X and a smaller number of 3% of X escape the inactivation. The number one is Klinefelter syndrome, and it usually affects the male. It occurs when a boy born with an extra X chromosome, and the genetically they appear in 47 XSY in 90% of cases. Other rare variable pattern 47 XSY or 48 XXX occurs in one in total 660 live male births inherited from the parents. Occur due to non-disjunction during the meiotic divisions in the germ cells of one of the parents. No phenotypic difference between those who receive the extra X chromosome from their father and those who receive it from their mother. Clearly be diagnosed before puberty. Clinically appeared as unicoid body habitus, like abnormal long legs, small atrophic testes with a small penis and legs, secondary characteristics, deep voice, beard, and male distribution of pubic hair. Gynecomastia may be present, low IQ level, and the ratio of estrogen and testosterone determines the degree of feminization in individual cases. This is the picture showing the Klinefelter syndrome patient. It may develop complications like anxiety, depression, osteoporosis, hypogonadism, cardiac and vascular disorders, diabetes, hypothyroidism, breast cancer, extracorporeal cancer, tumor, lung disorder, lupus erythematosus, and rheumatoid arthritis. On morphology and histopathology, microscopic level, anyone can see in the variable testicular tubular pattern, totally atrophied and replaced by pink hyaline collagenous material to normal tubules and repulsion between atrophic tubules. In some cases, all tubules are primitive and appear embryonic, consisting of cords of cells that never develop a lumen or progress to mature spermatogenesis. Prominent Leydig cells due to atrophy and crowding of tubules and elevated levels of gonadotropin. Another abnormality involving cytogenetics in sex chromosome is Turner syndrome. It is a condition that only affects female, a state of complete 45x of partial homosexuality. Caused due to non-disjunction, a pair of sex chromosome fails to separate during the formation of egg, resulting in abnormal embryo development with absence of one X chromosome. Common in pregnancies that do not survive to term like stillbirth or miscarriages, incidence in 125 to 3,000 live for females, not inherited with parent because standard female is infertile. There are the types of karyotypic abnormalities occur in Turner syndrome, like 57% are missing in entire X chromosome, 43% among 43%, 14% have structural abnormalities, like number one, an isochromosome of the long arm with the loss of the short arm, 46X. Number two, deletion of portion of both long and short arm, resulting in the formation of ring chromosome. Number three, deletion of portions of the short arm or long arm. And two-thirds, 29% of mosaics have 45S along with one or more karyotypic abnormal or normal cell types. Clinically, the Turner syndrome patients appear at high risk of gonadal tumor with Y chromosome sequence. Edema of Hennepin, distended lymphatic channel produces septic hygroma. Congenital heart disease is a cause of increased mortality in children. Failure to develop normal secondary sex characteristics, infantile genitalia with little pubic hair. Inadequate breast development, defect in nonverbal visual spatial information processing, short stature, amenorrhea, hypothyroidism due to autoantibodies and glucose intolerance, obesity, insulin resistance. This is the appearance of Turner syndrome patient. What is true hermaphrodite? The presence of both ovarian and testicular tissue. What is pseudo hermaphrodite? It is a disagreement between the phenotypic and gonadal sex. Female pseudo-hermaphrodite has ovaries but male external genitalia. Male pseudo-hermaphrodite has testicular tissue but female type genitalia. The genetic basis of these two conditions are quite and variable. Thank you.